a very merry Christmas. It is the season to be jolly, and I'm so happy that you made the time to tune in to Health and Wellness this Sunday at 6 p.m. My name is Zaitun Ali, and I'm happy. It is December, guys. It is December. Na tunamaliza mwaka vizuri. And on that note, I know most of you have been doing some sweet treats, you know, mmekula sana, vitu za skari, ice cream, and we are here for you today. And we want to talk about dental fluorosis. So it's about dental health, oral health, and right here joining me on set, I have Dr. Carson Opio to just talk to us more about this. Karibu sana.
Thank you.
Merry Christmas to you.
Merry Christmas.
Mbona hujaenda ocha wewe?
Tunashughulikia watu meno.
Na zako nakwambia ni bright.
Right, yeah.
I wish kabla tufanye interview ningekuwa nimekuja kukuona. His teeth actually look really good. And the topic of discussion, as I said, is dental fluorosis. He's going to tell us more about it. What is it? What are we talking about when you're saying dental fluorosis?
Okay, so dental fluorosis is
Yes.
that kind of, it is a developmental disorder on the enamel of the tooth that affects the tooth during the developmental stage if it is exposed to excess fluorosis in water. Yeah, so it presents in various forms, and mostly people get, I think, worried when the teeth have become mottled, like they are brown. Yeah, you see, it has increased, especially in Nairobi, because of the borehole water.
Okay.
Yeah.
I came across a research that they were saying in Africa, places like India, China, whereby the water actually has fluoride. Most of the time you find almost 40% of the global population suffer from this, and prevalence is high, especially in Africa. But there's a question that I really want to ask. Fluoride is also good for the teeth.
Yes.
To what extent does it now become a threat to now the oral health?
Now, there is recommended level fluoride is in water,
Yes.
but that depends on the jurisdiction in which you are talking about. In other, it differs as per the country, yeah. But the WHO recommended levels of water is around 1 milligrams per liter, yeah. You will find that in areas like Canada and probably United States, they have higher, what we call higher foreseeable enforcement, because they're being real. So they have raised that level to level of fluoride allowed in drinking water to a higher level. But we must know that the fluoride that actually affects most people
Yes.
is the one that from the cooking water, not the drinking water, because we forget. You buy the drinking water, which is defluoridated, yet you still cook with the same water from the borehole.
Daktari, we can't afford to cook with
which becomes worse.
mineral water.
Which becomes worse. Why?
How?
No. Luckily,
Yeah.
the world has developed, yeah, and technology has developed. There are water, what do I call them? The machines that can be used to remove fluoride from water, the fluoridators. They are all over in the market. So
Yeah,
right
purifiers.
now, purifiers. So like they can remove the fluoride from water up to a certain level or completely, and then there are some minerals that they actually add to the water. So it makes the water both safe for drinking and for cooking.
Okay.
Yeah.
And even before we look at how it causes dental fluorosis, probably you can highlight some of the importance of fluoride to our teeth.
Well, fluoride, there is this part of the tooth that is outside that people see that is white. Yeah, it is called enamel. The enamel itself is made of what we call calcium plus fluoride. Yeah.
Okay.
Yeah. So it strengthens the structure of the tooth. Yeah. But now the excess is what actually affects the development of the tooth, and it mostly affects kids. Anybody below 8 years should not use borehole water if possible.
Okay.
Yeah, because that is when the development of teeth happens until 8 years of age. So beyond 8, it might not affect a child as much as somebody who is less than 8 years. Yeah.
What about the toothpaste that we are using? we also know it has fluoride in
Yeah.
it.
And
So,
most of them, I think, have the recommended. That's why they have to go through the
oh, they have the recommended
yes,
one.
recommended.
So whatever we are using to brush
Yes,
our teeth
yes,
is very okay.
is recommended. Yeah.
Ah, okay. So those are some of the causes. In terms of now, most of the people right now in Nairobi, especially, we are using borehole water. So how can we prevent this in such areas?
Now, the main challenge that we have in Nairobi
Yes.
is actually with the developers. You have very beautiful apartments all over Nairobi,
Yeah.
but the planning is a problem because
Yeah.
the developers do not foresee. They are sinking boreholes everywhere, but they are not providing the safe way of using that water from the borehole. So I think it's something that probably requires a law to be enacted so that it is required for the developer to have a way in which they are going to purify the water, rid off of the excess fluoride, so
Okay.
that it can be safe for drinking. That is the only way.
That needs to be
Because
a requirement.
you can be very keen at home, making sure that the child uses water that is safe, that is not having excess fluoride. But now in school, what happens? If they cook in school, if they are giving water in school, because most schools have also sunk boreholes, so it becomes a very big problem.
So even drinking it, cooking with
yes,
it, brushing
actually
with
cooking
it.
is worse because it's concentrated. I mean, the fluoride is now precipitated.
Okay.
Yeah.
Okay. And I know we are talking about dental fluorosis, and some of the people will wonder, how does it portray? How does it come along? So what does it look like? Does it have types?
Yeah, it has types. Probably I would call them stages rather than types.
Okay.
Yeah. Yeah. So it depends on one is how long you exposed your developing teeth to water, and how much they were exposed to, how much fluoride was exposed, and how long it was exposed to fluoride. Yeah. So it will present as some people very mild fluorosis, whereby you see somebody has spots of white within the teeth. Some parts are whiter than normal. That is still fluorosis. Yeah.
Oh.
Yes, but it is in a mild form. Okay. Then we have the extreme end, whereby now the teeth are mottled. Okay. The teeth are, the enamel is mottled. I think we came with a client, a model client, who will actually demonstrate to the
Okay. So that will do
listeners
at the second
what
part of the show.
what an extreme fluorosis looks like.
Okay.
Like the teeth become pitted, they are brown, and if you look at them, they are just chiseling. Yeah.
By chiseling, what do you mean? Like,
yeah, it is the enamel itself is actually shedding off.
okay.
Yes. So that is extreme form of fluorosis.
Oh, and so that is from mild to now extreme.
Extreme.
Hakuna ile ya katikati.
There is, I mean, where you will find the tooth is the brown spots, but it has not started pitting. Pitting, that means it is not forming the holes, the rough holes over it. Yeah.
And people may also wonder, so as they portray like that, as you see the symptoms, you can identify this is dental fluorosis, but now does it have any effect to the health of our teeth? So is there sensitivity, is there pain that accompanies it?
Well, the main reason why people seek treatment for dental fluorosis is because of aesthetics. Yes, it's for cosmetic reason, because children who have fluorous teeth are actually mostly bullied at school.
Yeah.
So mostly children who are less than 6 years don't really care about it, okay? But between, I mean, after 6, 7, 8, when down, a child is coming to realization of whom they are, that is when it starts affecting their self-esteem. When a fellow child actually tells them that, why is your teeth different, it gets into them. Now, from that stage, you can start, the parent will actually seek help for the child. Yeah, of which, unfortunately, at that stage, there is nothing much that can be done other than, one, controlling the cause, which is eliminating the excess fluoride, and maybe just masking of those teeth. Masking meaning a layer of white material might be applied on those teeth, because at that age the child is not ready for definitive treatment. Yeah, whereby by definitive treatment I mean a permanent solution for the fluorous teeth, where like mine suffered from fluorosis because
Zimeshine
yes,
wewe,
we
bu
had
smile kidogo waone.
we had a borehole at home back
Yeah.
in the village. So that really, because my parents did not know.
Yeah.
So it really affected my teeth, and it really, really affected my self-esteem.
Really?
And I actually just corrected it 4 years ago, yeah? Yeah, so it's something that at adult level, I mean, somebody who is adult, I mean 17 and above,
Yes.
you can now do, maybe 18 years, you can now do a permanent solution for the teeth, because if the child is still too young, the pulp chamber, the nerve of the teeth is wide. So any procedure that probably is invasive at that stage might kill that tooth, yeah, or make it overly sensitive and necessitate unnecessary procedures like root canal at that stage. So you'd want to avoid that to let the tooth fully develop, yeah. So at 17 years, you can do procedures like crowning that I've done for myself.
Okay.
Yes, and veneers, okay, or snap-on, which we will demonstrate how snap-on is done in the studio today.
So now this is some of the treatment options,
Yes, options
that you're highlighting.
Yeah.
One, masking.
We have masking for children who are below 17 years of age.
Okay.
We have others like which used to be used before, but now not, because of advanced technology is no longer used, is microabrasion, where you'd go to a doctor to professionally scrap off the brown substance from the tooth. Yes, not scrapping off as such, but how do I call it? There's a chemical that is used to rub gently on the teeth, just to, it needs to be a very mild fluorosis for that to be done. In essence, you are trying to rub it off and trying to rationalize the teeth to look like, when somebody looks at it, to have an equal effect of whiteness, yeah? Or mild fluorosis can also be whitened with the laser. Yeah, the laser machine, the light shown with a chemical that activate that light, and then the teeth can be whitened. Again, the aim is to rationalize the color such that the areas that are spotted becomes the same. So it gives you an illusion that the teeth is white, yet they have just rationalized the tooth such that the spotted areas now look like the normal areas of the tooth. Yeah.
The one that you've said you're going to show us.
That is a snap-on. This snap-on, it is, how do I call it? It is a new, relatively a new technology, whereby some people may not be able to afford the definitive treatment like mine. Crowns are not cheap for sure, because the materials used is ceramic, so it's not cheap. Yeah. So if you are not able to afford that and you want a temporary solution, and probably you have a wedding for a short time, not long, you have a wedding, but you want to boost your self-esteem and you don't like the way your teeth look like,
It had to be
you
a
simply
wedding.
you simply swipe it on, and it's just from the name snap-on, you just snap it on.
Okay.
Be good for your groom, and
so can it
for
be
your
used
special
again
day
after my wedding, probably?
Yes,
Can
you
I
can still use
again?
it depends on the strength, on its strength.
Okay.
Yeah, and of course the only challenge with the snap-on is that the teeth must be aligned, because now if your teeth are not aligned, then chewing will also be a problem too. You must be not having a gum disease. You must not have gum problems
because of infection, or?
Yes, because now it is going to cover the teeth. All cavities have to be eliminated from the teeth. The teeth must not, you must have healthy gums, because now some people eat with them, and as you eat with them, it will have food packing, because now it is not, sometimes it is not tightly fitting the tooth. Yeah,
because of course you can't.
And some people even sleep with it, and you know, when you are sleeping, the saliva is stagnated, so plaque and all that will, you know, form acid, and that actually that's what starts the cavitation of the teeth.
What if now you have dental fluorosis and you also have cavity, and probably your teeth are not aligned? So
yeah, so that would mean, and that's why I'm saying fluorosis needs to be prevented. You know? The excess fluoride need to be read from water. Why? Now, a patient who has somebody who has fluorosis and a severe form, and at the same time have crowding, is a problem, because you remember, you know, we use braces to align teeth.
Yes.
Now, teeth that have fluorosis do not stick to the braces.
Are you
they
serious?
Don't, yeah, because it
so
will
you
come
can't
off.
Use braces?
The enamel is affected. It is the same enamel that you are trying to bond to the braces, so it won't bond. So the patient will be frustrated because they will keep coming back to you. The bracket is off. The bracket is off. The patient, if you don't explain to them, they may think you are incompetent, that you are not putting them correctly. Yet the teeth are the ones having problem, there is no bonding. The bonding cannot happen because the enamel itself is affected too. However, okay.
Do you actually tell them prior,
yes,
in case you want
tell
this?
them prior, but technology has also developed that now.
Yes.
Probably if we have time, we'll also demonstrate how we make invisible aligners, such that now you don't need to stick them to the teeth. You can actually wear them so that they can align the teeth silently.
Okay.
This has been used before for people who are in professions that do not probably allow the braces to be put, maybe a pilot, air hostess,
Oh, those,
a journalist.
they can't use braces.
Yes. Okay.
Reason
It's
being?
conspicuous.
Oh.
Yeah, like an army officer probably would not be allowed to put on the
Why
braces.
though? Why?
Uh,
Kuna pilot
you see,
amekuja kuwekewa
you see, there are jobs that
Yeah.
probably need seriousness, and
as a
when
journalist.
yes, it needs seriousness. So if somebody sees you, people have perception that braces are for kids. So when they see you aligning your teeth at an probably advanced age or as an adult, they are surprised. What were you doing when you were a child? But people don't know that people's circumstances are different. Maybe it is at the adulthood that you've gotten the money, now you want to look good. Yeah, because now it is affecting your self-esteem.
Okay.
Yes.
And you've talked about technology too much, actually.
Yes.
As a dentist, I can see you embracing
Yes,
the
yes.
power of technology in now addressing oral
Yes.
health. So for dental fluorosis, what type of technology have emerged on the scene?
Well, first of all, in developed countries, I'm not sure if we have it already in Kenya, but they are now using AI to detect excess fluoride in water instead of using the chemicals that used to be used in the government chemist to measure the amount of the fluoride in water. They're now using AI, yeah, whereby they are using some X-ray fluorescence analysis, yeah, and they remit that data to the computer, and the computer is able to detect from that amount of data whether the fluoride is in excess or not. It is a cheaper method, and as opposed to the previous one, yeah. But most importantly, now you realize most people that had fluorosis, especially in Kenya, before this technology came, they were going to Turkey to have their smile makeovers.
Okay.
Yeah, but now since we brought the technology as Lake Basin Dental, we brought technology to Kenya. I think we've reduced that need for going to India, going to Turkey, because the kind of remedies that I talked about, crowns, veneers, these are actually things that initially they used to be produced manually in the lab. But right now we will demonstrate how you can actually take 15 minutes instead of 2 weeks to get somebody a crown or a veneer. Okay, so this has reduced the cost because the waiting time is reduced, and going abroad has many challenges because once teeth should be functional, because aesthetics is not the main function of the teeth. It's supposed to be able to eat. Yeah? So if you do, for example, if I have done crowns and the way you're pressing my teeth are nice, but they can't chew or I'm in pain, then they become useless. Then the procedure doesn't make it, beats the logic, right?
Yeah.
So it needs reviews. So if, for example, you travel to Turkey to go and have a smile makeover because you have brown teeth, yes, and now you have come back, you are in pain, your case will still need to be addressed by the Kenyan doctors, the Kenyan dentist, and probably the Kenyan dentist at that time whom you visited does not have that technology, okay? And it forces them to remove the whole setup, the whole crown, so that they can do a fresh job or maybe do root canals on those teeth because they are painful. Or the bite was not corrected because you didn't have enough time. You went there maybe for 4 days and they did the smile, you loved the smile, and probably at that time you are still not feeling a bite problem because it's something that may develop over time, causing trauma from occlusion. Yeah. So once you start feeling pain, there is headache, and then you can't travel because it is expensive to travel back to. Yeah. So I think us bringing the AI, we are actually using artificial intelligence.
Which ones are you using? You said you're from Lake Basin.
Yes.
Lazima ungeita tu Lake Basin.
Yeah, okay, because it started from the lake. Yeah? It
Oh,
started
okay.
from the lake
And then you brought it to
to
Nairobi,
Nairobi.
where
Yeah,
Thika
because
Road.
yeah, Thika Road in
Okay.
TRM,
Yeah.
second floor. Yeah.
Ah.
So this we brought we are using AI
Uh-huh.
such that we do, instead of doing manual impressions, we actually design for you a smile. We scan
Yes.
laser scan. We do a 3D smile, and you can actually see your smile. That will be shown in part 2. You can see your smile before it is done.
Oh,
You can
really?
approve it. This is what I want.
Eh.
So you see now we've designed a template.
Yeah.
Like mine was designed, and I said, I think this is what I want. Okay.
Kusema ikuja na dimples.
Yeah. I think this is what I want. Okay.
Okay. AI.
So when I saw the design, I loved it,
Yes.
and that's what was produced.
So this one was done right here.
Yeah, right here in our clinic. Yeah, this was done 3 years ago, actually,
yeah.
and it's still this nice. You can
Hapo hapa
imagine.
mwenye alifanya
Yes,
tutamuona.
yes,
Aya,
he's going to
sawa, sawa.
demonstrate how
That's nice.
he's going to demonstrate how to actually design the crowns and
Yeah.
deliver them.
Okay.
Yeah. So you realize something like that, maybe a doctor would prepare the teeth and send the models, because it used to be taken manually, to
Okay.
Dubai or South Africa or wherever in UK, and then they will receive them after 2 weeks and try to fit them in. And sometimes there's a problem because it is not fitting in. You can imagine the patient is so anxious, is waiting for the smile, and all of a sudden is being told the crowns cannot fit. So we brought the AI system such that everything is done in-house, such that the production, the trying, the acceptability during the, as they do the trying, the glazing and everything, and then we cement, and the patient, everyone is happy.
Are there any lasting side effects to the
Yes.
treatment? Yeah.
Um,
Actually, not even to the treatment, the disease, not the condition itself. So, are there any lasting effects?
you will lose your tooth. If fluorosis is so severe, you will lose your tooth, because it will
Really?
break until it is fully gone. Yeah, if it is very severe, as the case we are going to demonstrate, it is so severe. So you will see that it's actually started losing the teeth and is still very young. Yeah.
Okay.
Yeah. The other thing is,
Treatment now, does it have lasting effects?
well, that's why I was saying
Yeah.
it is recommended you do your smile makeovers locally if you can get the technology here. Why? Because I've talked of sensitivity. When you are going to do smile makeovers, at that time you are numb, and probably you went there just within 24 hours, the crowns have been placed, and maybe there was sometimes human is to error, there is excessive preparation of those teeth,
Okay.
and therefore there will be an eternal sensitivity. That's the main side effects of the cosmetic treatment of the teeth, sensitivity. So all those needs to be checked, such that probably the crowns are cemented temporarily until all the veneer cemented temporarily, the crowns cemented temporarily, until all the issues that the patient probably will have after the procedure is done are finally solved. And then now you can cement the crowns or veneers permanently.
Based on your personal experience, probably what challenges did you face after doing that treatment?
Personally,
Sorry,
okay.
I forgot. Yours was called what? Which one did you use?
Crowns.
Crowns.
Yeah.
Okay.
Zirconia crowns, yeah.
So
Yeah, so, okay, it feels strange a few days after it is put, because
Really?
it is foreign, yeah. But after that, a few bite issues, yeah, because now this is something that is new, especially probably if you don't use an advanced scanning system, 3D scanning system, and it did not register the correct bite. It will really be a very big problem post the procedure, because now the bite will not be okay. You will not be able to replicate your normal bite. So chewing might be a problem for some time, but once that is resolved, I'm okay. I even forgot that I did the crowns.
how long did it take, probably the recovery period?
Maybe a week.
A week.
Yeah, it was a week.
Ilikuwa imewekwa kwa meno yako? The crowns are put on you?
Yes. You have to reduce the
Original.
tooth. Yes. And now that's why we came up with a solution. The snap-on that we are talking about does not require any preparation. They are placed over the teeth. But I said it must have what we call good case selection. Otherwise, you end up burdening the teeth with more dental problems like cavities and dental and gum disease. Yeah.
Okay. So I hope you're enjoying the episode so far. We've heard a lot about what dental fluorosis is and how we can even treat it. At the second part of the show, we're doing it practical. We get to see what Dr. Carson used to solve his problem. And we'll also see one of our patients mwenye pia yake ilikuwa mbaya kidogo, sasa ikakaa fiti. People are having amazing smiles during this Christmas. So please stay tuned. Remember, at the WhatsApp line is 0759 434389. You can holler at us also on our social media platforms at KTN Home _ at Ali _ Zaitun. So we are coming back shortly just to see what is going on in all this AI in oral health. So stay tuned. Welcome back. If you're just joining us, remember this is health and wellness, and a very, very Merry Christmas to you and a happy and prosperous New Year. I hope you're enjoying with your family wherever you are. Thank you for always staying tuned every Sunday right here on KTN at 6 p.m. And the topic of discussion today has been dental fluorosis. We've got to learn it's a condition that comes about where the tooth enamel is affected by the fluoride that we get probably in excess in water that we're drinking, in some of the toothpaste that we're using. And Daktari here has really taught us a lot also about the role of technology in addressing this condition. And I still have Dr. Carson Opio, who is a dentist from Lake Basin Dental Clinic. I also have Donald Nyakundi. He is a CAD/CAM expert. Huyu ndio mambo ya technology vivi nini unajua how to sort our teeth, give us beautiful and radiant smiles. And we have an amazing patient here called Dennis Mutuko. Karibuni sana. Great to have you again here. And also thank you for giving us insights about this condition and how we can prevent it. Daktari, what do we have right now at the second part of the show?
Well, I had promised to show how severe fluorosis looked like.
Yes.
Luckily, we managed to get a patient who has such a condition. So, as you've introduced his name, maybe you can just smile so that the viewers can see what severe dental fluorosis looks like.
Tuambie tu jina basi alafu smile hata kidogo. How are you?
I'm good.
And thank you for coming.
Yeah.
How long have you had the dental fluorosis?
Yeah, maybe since I was 7.
7 years.
Yeah.
Ah, okay. Did you come across in terms of, did you know what caused it? Do you have knowledge about how to treat it, and what kind of treatment methods have you undergone until this point?
Yeah, I knew it was the water. I'm from Naivasha.
Uh-huh.
Yeah, the water is salty. Yeah, and I just got to the Lake Basin, and they told me they will give me the snap-on.
Oh, hebu fanya tuone. Oh, okay. So, Daktari, for him, which method are you going to use in terms of treatment?
So, ordinarily, you will use snap-on, but we plan to do for him a full smile makeover. Yeah?
But you can remind us what snap-on means in
Okay.
case someone missed it.
A snap-on, I think the expert will actually demonstrate.
Ule mtu wa technology.
You should be able to put on gloves and show how, yeah, you already has it already produced, yeah. So you should be able to show how it looks like and how actually it makes the difference. As you've seen, that kind of fluorosis is very severe. His teeth have started pitting and chipping off, and I'm sure if you ask him, he's almost having sensitivity now because the inner part of the tooth, the dentine, is already exposed in some parts of his teeth. Yeah?
How old are you right now?
I'm 21.
21. Hizo ni miaka ngapi sasa? Hiyo ni almost 14 years.
Yes.
Okay. So past this, in case we don't
address it,
yeah.
Then now the tooth just simply breaks off until it is gone.
Okay. Yeah. Donald, tueleze, nakuona uko na mitambo hapo.
Yes.
Yeah. You can just explain to us what you have there and how you're going to demonstrate.
Okay.
Yeah.
So after we have already made the diagnosis and we have decided on the mode of treatment, the first thing that we usually do, the first thing that you're supposed to do is we do a scan. Yeah. The technology really helps us a lot. Yeah. You can be able to control the treatment. You can even plan, and you can even demonstrate to the patient the final outcome even before you start. Huh?
What technology is that?
So it's called CAD/CAM technology.
Yeah.
And CAD/CAM stands for Computer Aided Design and Computer Aided Manufacturing. So it's the first thing that you do, you have to make a copy of the mouth, how it is. And the copy is, of course, saved on the computer.
Okay.
After you've made the copy and saved it on the computer, the next thing is to do the design.
It's the one we're seeing there.
Yes, so this is an intraoral scan.
A what?
Intraoral scan.
Okay.
Just in layman's is just a copy of the mouth. Yeah?
In 3D form,
In
not
3D form. It's not in,
You
it's
can
not a
actually
picture.
able to turn and see the other side of the.
Yes.
Oh,
as you can
really?
see, yeah, you can
Talk
you
about
can
technology.
you can evaluate any point of, yeah.
You can see
So
the cavities.
this
you can
gives
see the
us-
gums are affected,
Yes.
and it brings it in a original color.
Yes.
Yes.
So as you can see, this is it's a exact copy, 100%, and it's advantageous because of its precision. Yeah, there's a lot of accuracy when you use this technology. Traditionally, we used to take impressions, but now we just do an intraoral scan.
Okay.
And with an intraoral scan, you're supposed to use a scanner here, yeah, which I'll demonstrate for now. And
Okay.
yeah.
Oh.
Now,
So
if I may explain, the image is real time. It's not like the whatever we used to take and then you wait for it to, to
Expect to
cure.
come out after 2 days. Or
Yeah, you take an impression, you wait for it to harden, and then you pour the stone and then get the model. This is instant. You scan as you see.
Okay.
Yeah, so it's not just, it's also a diagnostic tool that you can, even when the patient is not there, because now you have a true representation of the patient. It's like having the patient with you, yet they are not present physically. So,
Oh,
yeah.
You can do this remotely?
Yeah, you can do this remotely.
How? Like he takes
So,
a picture?
No.
Oh.
What happens is that he can take the scan and it is connected to another computer, so I can view directly.
Okay.
Yeah. So we'll be able to communicate, yeah?
Okay.
Yeah.
yes. So what I'm holding now is an intraoral scan. So this is the device that we first use when you're taking measurements. As I said, traditionally we used to take impressions, which was it was prone to inaccuracies, and also in terms of the experience for the patient is not good.
Okay.
Yeah, but when you use this intraoral scanner, it's very precise, it's accurate, and it's also very comfortable for
No,
the
si
patient.
uchungu.
Si uchungu.
You've ever used it before? Oh.
Yeah.
Okay.
So what I'll do now, I'll just do a demonstration. So, okay. As you can see, the patient bite, you can see the fluorosis. You can see that the teeth have chipped. Yeah, they are really chipped and they are very rough, as you can see. So what I'll just do a demonstration for a scan, and you should see the mouth is getting copied on the other side. You can see in real time, yeah? So you just do a scan like that. It's very comfortable. Think
Yeah.
of it like you're just taking selfies of your mouth.
Just continue
Yeah.
so we may be
Yeah.
able to get it.
It's very comfortable.
Wow.
And it's very detailed. Yes. So when you use an intraoral scanner, yeah, it gives you a lot of power as the practitioner, because you can it gives you like a lot of information that you don't have to do real time on the patient
So
directly.
some of this being?
So there are some details that you can see here that maybe your eye cannot perceive directly on the mouth. So that's the number one advantage.
Okay.
Yeah.
So right now you're able to see
Yes, and it's
how severe
very
it is,
comfortable.
or
Yes, you can see how severe it is, and
You can actually appreciate the angles of the teeth that your eyes cannot see directly.
Yes.
Because it is a 3D presentation.
yeah.
You are able to turn it. Maybe the patient may not be able to turn their head and all that. You can get tired. The patient also get tired. So once you have that image, you can have a detailed look on it, probably you had so many patients on that day, and maybe you've not given the patient enough time.
Yeah.
You know, so when you have this 3D representation, you can actually look at it and be able to see some things that you are in a hurry, you are not able to see when you are doing the physical examination.
Oh,
yeah?
that makes sense.
Yeah.
By the way.
So you can see it actually presents the gum in its original form. So if there is a gum disease, as you can see, his gums
Yes, it
are not
becomes-
very healthy, not very healthy. So even the treatment for him will start from treatment of that gum. Okay?
Okay.
You've seen some areas look like we are maybe having cavities, as you can see on the scan.
Okay.
And that would need fillings.
So
Before
fillings.
cleaning, fillings, the
Gum.
you know, maybe some mouthwash, some antibiotics therapy on the gum, local antibiotic therapy on the gum to make the gum healthy first before you even think of the snap-on. Yeah.
So is it
Yes.
because of the fluorosis that all
No,
these are happening,
this
the
is-
cavities?
This is majorly because I don't know, but I've seen so many people who have fluorosis. They also have issues with oral hygiene
Yeah.
because they feel they don't feel confident enough, so they don't really in that habit of taking care of their oral hygiene. Yeah, so it goes hand in hand, not because fluorosis causes it, but because of the stigma it brings
Yeah.
when you have dental fluorosis. So you tend to give up on your teeth because you feel like your teeth are different from the rest of the people. So that is mostly what I have seen. So such that the patient comes to you, they have very severe fluorosis, but also the gums are cherry red, actually bleeding when you try to probe,
Yeah.
when you try to examine. So in that case, you will start to, you cannot just go ahead and probably do a crowns for that patient or veneers or the snap-on. This gum tissue, since the teeth are housed by the bone and the gum, covered by the gum, the house has to be healthy first, yeah, such that the teeth, the crowns themselves are not actually going to add excess load to the
Okay.
already gum that is problematic. Yeah.
Okay.
Yeah.
So now after the scan, what next?
Now we need to design.
After the scan, we have already made a copy. You can see it on this computer. So once I've already saved the scan, the next step is now the designing bit.
Okay.
So there are different designing softwares, but for us we use Exocad, which is the best in the world.
Wow.
Yeah, it's the best. So what you can see is now the scan of how it's an exact copy of how it is on the mouth.
Okay.
Yeah. So the next thing I'll just show you the design that I've done. As you can see, the
So
white
now
part.
the software also, based on what
Yes.
the results you've gotten,
Yeah.
helps you to now
design.
identify which is the best.
Yeah.
Yes.
So
So
it's able to design the teeth, and you can see it's already, if you were to produce those crowns, those are ready to be, produced. Yeah.
yes.
So you show the patient this is what they are. You see the teeth are already white, actually different from what. So you can color it so that the patient can see what they are likely to have at the end of the treatment. Yeah. So
Yeah.
if the patient approves, then you go on with the treatment plan.
So this
Because there
is
are patients who will want, probably he says, I want, probably in their family they have long teeth, and fluorosis have actually made the teeth short, so they want you to reproduce the teeth the way they were before. So they have to approve the design, what we call the smile design or the mock design. Yeah.
So whatever treatment method you're using, be it the snap-on or
Yes,
the
yes, yes.
crowning,
They have to-
it's still
Yes, yes.
okay.
Yeah.
Hey,
It's the same
technology.
The same process. Yes.
So yake snap-on ile ulisema it's not permanent.
Yeah, it's not permanent.
So you
You
can,
can use it for occasions, probably as
for
you-
how long can you stay with them?
It's something that you can use even for 3 years, yeah? As long as
Oh,
you take
3
care
years
of
at
it,
least
because
ni mingi.
you need to clean it.
Yes.
Yeah. It is made of flexible material, yeah? It's a
So the
flexible-
challenges
Yeah.
that you mentioned, probably you can highlight them to him as he takes up this opportunity.
Okay. The challenges is that it's not as strong as crowns or veneers, so you cannot be able to chew with it.
Okay.
Very hard food.
Yeah.
It can break. Okay. You also may not be able to sleep with it. Why? Because as I said, it can cause problems to your gums, just the same way you cannot sleep with a denture, because stagnation of saliva when there is no motor activity when you are asleep. So there is no self-cleansing of the teeth with the saliva. So that stagnation can cause can make your teeth to start having cavities or the gums to become irritated. Yeah.
Okay.
Yeah.
So how can he be able to take care of them, at least to ensure that
He needs
they last?
to, when you have snap-on, definitely you need to follow instructions. Just put it on, we call it socially sensitive events. Like I told you, wedding, if you have a wedding, very fast.
Wewe unaenda wedding?
Yeah.
Huyu
Very
hakai
fast.
kwenda wedding.
But for him,
Yeah.
as he plans
Okay.
to do the definitive treatment, this
Yeah.
can be a remedy.
True.
Such that, as you have seen his teeth, yeah, I think mine was almost to that level,
Okay.
and it really used to affect my self-esteem. As you can imagine, I'm a dentist, and I'm really trying to tell somebody that
By the way,
yeah, it transforms
was this
minds.
the reason why you became a dentist?
A dentist, yeah, for sure,
Uongo.
sure. This really affected my teeth, for sure.
So
It
when you're
really
growing up, you
affected
were
my
like,
self-esteem.
I have to
Yes,
become a dentist so that I can
because
fix this.
it was so expensive to correct it. Right now, actually, we've made, since we brought AI to Kenya,
Yeah.
we've really made the treatment very affordable.
Okay.
Because crowns used to cost as high as 70,000 Kenyan shilling per
Uh-huh.
tooth. Right now, you can get a crown even at
Na tuko na
20,000.
meno ngapi? 32?
32.
Ah. Oh,
Luckily,
God.
when
Uh-huh.
you're doing a smile makeover, you don't need to, do all the teeth. You can probably do it on just the smiling zone.
Oh.
Yeah.
So what about now snap-on? Probably how much does it cost?
Well, the cost varies depending
Uh-huh.
on how many number of teeth it is going to cover. But
So an estimate per tooth?
basically, not per tooth, it's
Oh.
just charged per mouth because
Okay.
it's per jaw. We have 2 jaws, up and lower. So 50,000 per jaw.
Okay.
Yeah.
Aya, hey, na wakupata wapi wakikuja? Wanataka, everyone wants to know how, I'm
Yeah.
sure so many people want to know how they can
We
do
are
this.
located at TRM Thika Road Mall,
Uh-huh.
second floor. And we are actually having a discount
For this festive season?
for this festive season, 40% discount. Can you
What?
imagine that? 40%
Wadau.
discount
Wadau.
from 5th
Uh-huh.
to 7th of this December.
Wow.
So everybody is welcome. And as I'm telling people, please don't travel abroad. We've seen cases whereby very nice crowns were done. The doctor was very professional,
Yeah.
followed all the standard protocols. But the bite was not okay. And probably the doctor was not able to see this. Or there are people react to sensitivity differently. You can find that somebody's tooth is just lightly chipped and is so sensitive, while some people you reduce their teeth probably considerably a lot, but it doesn't get to become sensitive. So we are recommending that you do your smile makeovers locally, so
Yeah.
that if there's a problem, your doctor
Can
can
be addressed very
able to,
quickly.
to address it.
Thank you so much, Daktari. Don,
Yes.
tukuje utufundishe mambo ya AI.
Yes, you're very welcome.
I hope we've not left out anything there.
Yeah, so the final thing that I wanted to add is
Kindly do.
what we have done is just the designing bit.
Yeah.
Now there's the manufacturing bit,
Okay.
where the actual crowns are produced. So what I'm holding right now, this is called a 3D printer, and it's one of the devices that we use to produce now the actual teeth.
What?
Like for him, we use this particular case.
Okay.
What I'd like to also show is the results. So after you've done the design, the next step is now the production bit.
Yeah.
So what you do, you just take this file and send it to this machine. This machine, you'll just give it a bit of material, and then it will produce for you now the actual teeth that will be
What
used.
kind of material?
So for this one is we just use normal resin. Yes.
Okay.
So you just put
we
a
act
bit of
like
resin.
you know what that is.
Like composite,
It's-
like the
Oh.
filling. When you go to
Hey.
the doctor, the
Uh-huh.
filling material that they use to fill your tooth, the tooth-colored material,
Okay.
is simply what we use to make the
Yes.
snap-on.
Oh.
The
So-
only difference is that the filler content is lower, so it is more flexible. Yeah.
Okay.
Yes.
Yeah.
Okay, as we wind up quickly utatuonyesha, we have like 3 minutes.
Yeah. So
Yeah.
for
Just show
him,
the snap-on.
yeah.
Just put it
So
on and then. Yeah.
once
can-
I did the design, I just sent the file to the machine,
Okay.
and it produced this. Yeah. Yeah. This is what it produced.
Can I see
Yes.
closely?
Yes. Yes.
Oh, I'm not supposed to touch?
No, don't
No,
touch
because
it
it's
is-
going to his
Ah.
mouth. Yeah. So
Okay.
you
Probably,
can
can the
just
camera
see-
catch that?
Yeah. Yeah. You can
there.
just see that these are the actual teeth. And
Sawa.
what I'll do, I'll put them on,
Okay.
and then you can see the difference. Yeah.
Let's see.
Yeah. So for now,
Mtu atatusmailia hapo.
Yeah, you
Na
can see
tulisema
how
mtafute ile
brown
na
it
come na
is.
dimples.
yeah. So the next thing, the snap-on, you just put it on. Open. And there's no preparation that was needed.
Oh.
And you can see
Instant.
it's instant.
Please smile, we see. Oh,
Yeah.
guy.
Even
Yeah, it's a makeover for sure.
Yeah.
summer cover.
So you can see the difference.
Hebu toa mkono
Instant.
tuone.
Yeah. You can
Remove
see
your
Oh,
the
you have
smile.
to
Remove
hold
your
it.
hands.
Aya,
No,
smile.
no. There's no need for holding
It's
it.
self-retentive. That's why
Yeah.
I said this.
Handsome.
Yeah.
How you feeling?
Yeah.
Okay.
Yeah.
Does it feel awkward?
Yeah, for the first time,
Yeah.
Yeah.
it's kind of
You've been using them?
no.
First time?
Yeah.
Oh, okay.
Yeah.
So the upper jaw and then you put others
Yes,
for
and
the
then
lower jaw.
they'll be, yeah.
Okay.
Yeah. For
But-
the demonstration, we just did the upper jaw.
Shinda
only.
tu hivi, itabidi umeshinda
Yeah.
hivi. Yeah.
Of course, because it's
Tumemrekesha
foreign to
soko.
the mouth.
Eh.
It takes a bit of time to get accustomed to it.
Okay.
But they work.
Mi hata na smile kukuliko na sijaekewa. Sasa nikiekewa.
Yeah, you can see the difference. Yeah,
Okay. Yeah, that's a very, very
yeah,
big
it's very
difference.
big. Yeah.
Na niyo mashini imetoa hivi.
And
Just,
by the way, you
yeah.
can choose color.
Oh,
You can make it extremely
nikitakalia
white.
gold.
Yeah, you can
Even
get-
gold, you
get-
can have it.
Yeah.
Aya,
Yeah.
guys, thank you so much for coming. Thank you for the demonstration. At least it's not talk.
Yeah,
We
yeah.
can see the results
Yeah.
right here and right now. Umesema real time,
Real time,
guys.
real time.
I hope you've enjoyed this show. We've actually created awareness on dental fluorosis, and we've had how we can prevent it. We just hope landlords huko nje, wale kwanza tunaishi diaspora, mtuweke hizi nini maji ya borehole sana with so much fluoride. You know, there's an extent as to how much we are supposed to actually intake, and also we need to be keen about children under the age of 8. So it is usually at the developing stages that you can get this condition. Guys, thank you for tuning in. It has been Health and Wellness. My name is Zaitun Ali, and you can find this episode on YouTube at KTN Home. Until next Sunday, have a Merry Christmas and a Happy New Year. See ya, guys.